So, hi, everybody. Thank you so much for joining us. My name is Marilyn Salazar, and I serve as the Communications and Events Manager for Facing Forward.
And I am Esther Sheely. I am the Corporate Engagement Manager here at the Greater Chicago Food Depository, and we are very proud to come together this year for our 4th annual panel for Hunger and Homelessness Awareness Week.
That's right. So this year, our panel is dedicated to providing an overview of how food and housing insecurity is affecting our neighbors here in Chicago. So we'll be diving into the latest statistics and trends that we've been seeing, the root causes of these issues, and some collaborative solutions that we can all get behind to create a lasting change in our community.
Our moderator this morning will be NBC5 Chicago's Michelle Relerford. Good morning, Michelle. Thank you for joining us today.
Good morning. Thank you so much for having me, and welcome to everyone who is joining our panel this morning. I can't believe this is my 4th year hosting this panel for Facing Forward. It's an organization that I've come to know and love over many, many years, and I always try to be of service anytime they need me because I really, really believe in this organization and its mission. And I have seen this organization really change lives, and I've heard directly firsthand accounts from many people who have been helped by Facing Forward, and seeing their lives and the lives of their children really transformed through this organization has been a real joy for me. And so I'm really happy to have all of you joining us this morning to talk about some really important topics and figure out ways that we can all do our part to really make a difference in some lives. A few orders of business here. There will be a Q&A towards the end of this panel, so I want to make sure that you're aware of that. You can submit your questions at any time using that Q&A function at the bottom of your screen. We also encourage you to go ahead and use that chat. We want to hear from you. Let us know where you're joining us from, and feel free to share your thoughts and your reactions as you listen to this conversation this morning. I'm going to begin our program and our discussion by introducing you to our panelists for today. So I am going to begin with Venus London of Facing Forward to End Homelessness. Born and raised in Chicago, Venus London has been an integral part of Facing Forward for more than 6 years. In her current role as Director of Programs, she offers her expertise as a licensed clinical social worker to guide family-wide initiatives against homelessness with a focus on trauma-informed care. Venus is also a graduate of Chicago State University and is committed to combating racial inequities, actively serving as a member of the organization Color of Change. Also this morning, we have Amy Laboy of the Greater Chicago Food Depository. Amy Laboy has been a vital part of the Greater Chicago Food Depository since 2014 and currently serves as their Vice President of Programs and Community Partnership. Also hailing from Chicago, Amy leverages more than 2 decades of experience in the nonprofit sector to lead the development of community programs, foster partnership, steer workforce development initiatives at the Food Depository as well. She's also a graduate of Valparaiso University and Indiana University. She brings valuable prior experience in developing programs to enhance skill building and community engagement for adults with disabilities. And so we are honored and privileged to have these two very successful and passionate women as part of our discussion this morning, and we look forward to this conversation. Before we dive in with today's panelists, we want to get a sense of your perceptions on food and also the housing insecurity situation in Chicago. You can see there a look at your screen. We're sending a few audience polls. It's going to pop up. You should see it there. And we're going to start with the first question and think about your answer here. And estimate it. Do you believe it's 1 in 7, 1 in 3, 1 in 20, or 1 in 10 and Chicago public school students experience homelessness at some point in their academic career? Well, now that you've had some time to consider, I'll give you the answer. The answer is an estimated 1 in 7 Chicago public school students experience homelessness at some point in their academic career. Chicago is more than 20,000, 100,000, 50,000, or 80,000 units short of the affordable housing it needs. Well, the answer to this question is 100,000. Chicago is more than 100,000 units short of the affordable housing it needs. The next question, an estimated, do you believe 1 in 5, 2 in 5, 3 in 5, or 4 in 5 households in Chicago, or in the Chicago area, I should say, are food insecure? The answer is actually an estimated 1 in 5 households in Chicago, in the Chicago area, are food insecure. Then our final question for this morning. The Food Depository distributed the equivalent of, do you believe 29 million, 43 million, 67 million, or 76 million meals to people at risk of hunger during the fiscal year of 2023? And the answer to that question, 76 million. The Food Depository distributed the equivalent of 76 million meals to people at risk of hunger during the fiscal year of 2023. So thank you all for participating in that poll, and hopefully some of the information provided some food for thought for you already before we dive into this important conversations. These numbers, not just statistics, of course, they represent the very real struggles that people are facing every day, individuals and, of course, families in our community. So stay with us now as our panelists, Amy and Venus, get ready to dive deeper into these important questions. So we're going to begin with our very first topic for the morning, the state of hunger and homelessness here in Chicago. So to begin our conversation, we'd like to give an overview of what the landscape of hunger and homelessness looks like in Chicago. So we're going to kick things off with Amy Laboy. Amy, we're going to start with you. Can you begin by helping us grasp the current situation of food insecurity here in Chicago? And we're hoping to uncover some important details that may not always make the headlines. Amy?
Yeah, thank you for the question. And first, thanks, Michelle and Venus, for doing this panel. This is so important, and to all of you for joining us. The reality is that hunger is actually a persistent issue in our community. Food insecurity and the need for food and in Chicago and Cook County, it remains really elevated right now. And about 19% of households in the Chicago area, which is about 1 in 5 households, are living with food insecurity. And when you actually look at households with children, it's about 22% of those households, which is 1 in 4 that are experiencing food insecurity. When we look at the national data, as well as here in the Chicago area, Black and Latino families with children are disproportionately affected by hunger. So 23% of Black households with children and 31% of Latino households with children in the Chicago metro area are experiencing food insecurity, compared to that of the 16% of white households. So that definitely is an important indicator as we think about the issues and the conversation ahead. At the Food Depository, we are a network of amazing partners that are helping to support food access as well as programming. And as you heard Michelle lift, that last year alone, we distributed 92 million pounds of food, which is the equivalent of 76 million meals. The reality is, since March of 2020, we have been responding to increasing food needs, clearly because of the pandemic. And even post-pandemic, a lot of needs continues to persist. While we are on the other end of a pandemic, and that's a different topic, we certainly recognize that families are really struggling putting food on the table with the rollback of the pandemic era support systems and public programs that were put in place. And so as a result, even today, when we think about that network of partners that are doing the work, we're in this moment of today seeing 13% more individuals utilize the programming than we did the same exact time last year. And even in the last 2 weeks alone, we've worked through our partnerships to distribute over 4 million pounds of food, and that's just within the last 2 weeks. While there's a lot of need, we know there's a lot of opportunity to work collectively to solve this, to help bring solutions to that. And so looking forward to continuing that conversation.
All right, Amy, thank you so much. And let's talk more about the need now in terms of homelessness as we direct this next question to you, Venus. Exploring the issue of homelessness in Chicago, how many people are experiencing homelessness? What communities are you seeing hit the hardest right now?
Thanks, and good morning, Michelle, as well as Amy. I am starting off by saying I'm grateful to be here today to talk about this serious issue. And so I'll start out here giving some background and context for the issue of homelessness in Chicago. There's an estimated 68,440 people experiencing homelessness in Chicago, which is actually nearly a 10% increase from the numbers we saw in 2020. This data comes from the latest report by the Chicago Coalition for the Homeless, which also found that over 1/3 of people experiencing homelessness are in family units. 15% of those families are led by youth under 24. Many families experiencing are what we call doubled up, couch surfing, or temporarily staying with others. Doubled up situations are often unstable due to overcrowding, interpersonal tensions, and so on, and can ultimately result in literal homelessness. Kids under the age of 18 make up more than 27% of people experiencing homelessness in Chicago. And according to a study conducted by our partners, UChicago Urban Labs, 1 in 7 Chicago public school students experiences homelessness at some point. At Facing Forward, we are increasingly focused on providing programs and services to meet the unique needs of families and children. The report also found that 82% of people experiencing homelessness are people of color. And despite only being about 29% of the population, Black Chicagoans make up over half of all people experiencing homelessness here. Like the disparities we see with food insecurity, this data tells us that problems like not having a place to live or not having enough food aren't affecting everyone in Chicago the same way.
Venus, thank you very much. So let's delve a little bit more into the root causes of these issues that we're discussing. It's important, of course, to recognize that food insecurity and also homelessness, not just problems, of course, they're symptoms of deeper challenges within our community. So in our next segment, let's unpack some of these root causes of food insecurity and also shed some light on the systemic issues contributing to the issue of homelessness in Chicago. So Amy, we're going to start again with you. Can you delve a little bit deeper into some of the underlying causes of food insecurity?
When we think about food security, if we zoom back and we think about what is the main cause, and I think we'll hear some of the same things when Venus talks about homelessness. It starts with poverty, and the reality that individuals that are living in our community are having to make really difficult decisions about how to gather income, as well as how to make those trade-off decisions about what they need to do with those dollars to support their families. And when we put that in the context of sort of that historical issues of our region and the eras that we've lived through, obviously we recognize within that there's large factors that include the systemic racism and disinvestment that many of our communities have experienced. And so recognizing that layers of poverty, the layers of inequities throughout our communities, it really is exasperating the issues of both hunger and homelessness. Again, we know, we've already been talking about, the Black and Latino households are experiencing at twice the rates as white households, which is a really important topic to continue to focus on. What we also know, it's not a one size fits all. So when we go in to help support or co-create solutions, there is no one way, and that we really have to do work in collaboration and really understand the needs of individuals and the communities that we seek to serve, and how do we work on co-creating solutions. And so definitely thinking about the work in prioritizing how we show up in community and where we show up, and really thinking about it through the lens of equity. And for us, that looks like being able to identify and call out those communities. And for us, we've identified 40 communities that have over the years have experienced high rates of poverty, disinvestment, low employment opportunities, et cetera. So really thinking about and addressing those issues.
Amy, thank you so much. And Venus, of course, we're going to see some parallels here, but could you share some of your insights into the root causes of homelessness in Chicago?
Of course. Homelessness in Chicago stems from a variety of interconnected factors, often including economic challenges and systemic issues. Nationwide, a lack of affordable housing is a top cause of homelessness. In 2021, Department of Housing Commissioner Marissa Novera said that Chicago is more than 100,000 units short of affordable housing it needs. As rents continue to rise, the gap between income and housing costs also widen, making it harder for vulnerable populations to find affordable and stable living arrangements. Minimum wage in Chicago is currently $15.80. However, to afford a modest 2-bedroom apartment at fair market rate, a person working 40 hours a week would have to earn $28 an hour. According to DePaul University's 2023 report on the state of rental housing in Chicago, over 50% of rental units were cost burdened, spending over 30% of income on rent. These findings also pointed to the highest affordability gap in at least a decade. We also know that homelessness disproportionately affects Black, Indigenous, and people of color community members at a higher rate. But why? For one, historically, Black Americans have been systemically denied rights and socioeconomic opportunities. Other minority groups, including Indigenous and Latinx people, share similar histories. For these groups, limited access to quality education, employment, and healthcare continue to contribute to the cycle of poverty, which increases the rate of homelessness in these communities. Another cause of homelessness can be traced back to the fact that many Chicagoans are just living paycheck to paycheck without a security net. One unexpected life change, such as a layoff, unforeseen medical bills, and so on, can lead to becoming unstably housed. Meanwhile, for other Chicagoans, barriers like low credit scores, previous evictions, competing bills, and the inability to create generational wealth often keep stable housing out of reach. There are many stereotypes linking mental health challenges and addiction to homelessness, but the reality is much more nuanced. These issues can be both a cause and effect of homelessness. Mental health issues like substance use disorders, severe anxiety, and depression can be both the cause and effect of homelessness. Some individuals experience these challenges before losing their housing, while for others, the harsh reality of homelessness can lead to the development of mental health issues or excessive use of substances as a coping mechanism. Homelessness is often a cyclical issue. We know that if a person has experienced homelessness once, there is a higher probability that they will experience it again. The same can also be said from one generation to the next. Experiencing homelessness as a child is a predictor of experiencing homelessness later as an adult. Adverse childhood experiences, such as experiencing homelessness, can have long-lasting impacts on a child's well-being. At Facing Forward to End Homelessness, we believe that breaking the cycle of homelessness requires a two-generation approach that provides trauma-informed care and support for all members of the household we serve.
Venus, thank you very much. So, of course, we're not just here to discuss the issues here. We want to talk about what can be done to help. And of course, both of you are with organizations that are not only working to understand the issues, but also working on being a part of the solution. So let's talk about some of the programs and initiatives that are already in place. Amy, why don't you begin with talking about some of the programs that the Food Depository is offering to end hunger?
Thanks. Yeah, so with our mission to end hunger, we have to think about it in a couple different ways. And top of the list is, how do we break down the barriers to food access? And then how do we address and show up for the issue of supporting solutions that alleviate poverty? So what is our role in that? And so we think about that in different pillars of work. First and foremost, how do we ensure people have access to food? And how do we optimize that access and do so in a dignified way? So if you know the Food Depository, you know we have an amazing network of partners that are distributing groceries and meals, and that within that, we are working to make sure that we're breaking down barriers for specific populations as well. So if you're thinking about how do we address youth hunger or meet the needs of older adults, making sure that we're co-creating programs where individuals can have food at the locations in which they're already living, going, experiencing, and making sure that that food is nutritious and is what they want. We do that in a lot of different ways through a lot of different program models, because again, it's not a one size fits all, and there's lots of different barriers to access. A grocery program could show up in your community at your local church or a nonprofit organization where people can shop and have amazing choice. It can show up as a meal as well, and there's lots of different meal programs. One of those includes our own prepared meals that go out to community as well. So there's a lot to make sure that we're doing a lot to break down those barriers of food access. We also recognize that we really need to make sure that we're strengthening the safety net and ensuring everyone who's eligible are connecting to those benefits and resources. So when you think about individuals accessing groceries and paying for groceries, obviously we want to make sure those that are eligible are connected to SNAP, that they're receiving Medicaid benefits if they're eligible. So how do we make sure people are unlocking all the resources and support that help benefit choice and put food on the table? And then we think about the issues of poverty. So how do we show up to make sure that folks who are eligible and want to have access to a living wage, how do we show up to do that? And that shows up by us, our own workforce development program, again, working in partnership to, lift voices and advocate around the policies and the needs of community in a way that really enforces and drives living wage. And then the fourth thing that we think about is, how do we show up to build economic opportunity? So while, again, we're working to make sure people have the access to the food and the nutrition that they want, need, and deserve, how do we do that in a way that's truly investing in community? So while we are absolutely, making meals and very proud of the meals that we're making, we're also ensuring that we're leveraging and investing in other partners and community meal producers to purchase those meals, to then get those meals connected to folks in the community who need it. There's examples of working with urban gardens and making sure those urban gardens are connecting to people in community who need it. So it really is a multifaceted approach with a multitude of programs to ensure that we are really maximizing access to food, but also addressing issues of poverty.
Wonderful and really encouraging to hear. I mean, we know the need is great, but so many resources. And I believe NBC just had a conversation with the Food Depository nationally, really just bringing more awareness to your programs that are running right now to make sure so many families in this area can have a happy Thanksgiving and can have a Thanksgiving meal. But again, of course, as you just pointed out, this is something that you're doing year round, not just for Thanksgiving, and helping many families through many food pantries in that way. Venus, let's talk about some of the programs that Facing Forward has in place to address homelessness.
Sure. Facing Forward provides stable housing, whole family case management, and a suite of supportive services to help families and individuals end generational cycles of homelessness. Last year, we served nearly 3,000 individuals, and we believe our approach to helping clients reach their goals is everything. We start with what we call meeting people where they are. No contingencies, no conditions. Come as you are, and let's work together to discover ways to move forward in a positive direction. This begins with housing first, and just like the name sounds, this is the belief that housing must come first. Having a safe and stable place to live creates a foundation for people to stand on and begin to work on making improvements in other areas such as health and income. For example, it's difficult to get a job or improve one's health when you don't have a place to sleep at night, a home base. This approach is widely accepted now as a national best practice. Having a strengths-based approach helps us stay client-driven. We work with our clients to find assets, not problems. We use this information to create an empowering path to personal growth. Facing Forward also uses a two-generation lens in our work that looks at the entire family. Research shows that parents are better able to move forward with their own goals when they feel comfortable that their kids are doing well, and vice versa. We want to help the whole family stabilize and build towards their goals. Okay, let's get into some specific program areas now. Our primary program is permanent supportive housing, which we also refer to as PSH. PSH is long-term housing for people with disabilities, providing housing and case management to our individuals and families who are most vulnerable and need long-term support. Some move on from the program, and others actually stay stably housed in PSH for the rest of their lives. Both are a success. Seeing the needs of families in our community who don't qualify for federally funded programs such as PSH inspired us to launch a couple of innovative pilot programs that build on the two-generation approach and provide short-term housing and other support. First, we have one of our programs called First Foundations. It serves unstably housed families with a pregnancy or a child under the age of 3. This demographic is very vulnerable, but may not be eligible for other housing programs, which is why the program is so critical. We provide 2 years of rental assistance and help them get into apartments. We also provide family-wide support to help build stability. This includes targeted support for young families, like connections for prenatal health, parenting resources, and life skills and employment support. Combining these supportive services with housing can make a big difference, particularly when it comes to healthy birth and early childhood outcomes. Since its launch, First Foundations has served 23 families. 100% of households in First Foundations program are insured and connected to a healthcare home, which is very important for young families, especially those with it or who are expected parents and have newborns. Next, we have Home Connections. For this program, we partnered with the Chicago Public Schools and the University of Chicago's Inclusive Economy Lab to serve unstably housed students and their families. The United States Department of Housing and Urban Development doesn't include doubled up families in its definition of homelessness. This is the majority of families with children experiencing homelessness in Chicago. Studies have shown that the effects on children of being doubled up For example, poor school attendance, trouble concentrating, social and behavioral struggles, and so on, are basically the same as literal homelessness. This allows us to serve families that often would otherwise slip through the cracks and add comprehensive youth supports for our family empowerment team to mitigate the impacts of homelessness on CPS students. This year, we are expanding support through our Home Connection program by providing a full year of rental support for nearly 100 families by summer of next year. Finally, we have our family empowerment team. As Facing Forward began to serve more children than ever before, we knew that we had to do more to support those families. So we assembled a team with age-specific expertise to help families and children from birth to age 24. The Early Childhood Advocate provides parenting supports, developmental assessments for children through the age of 3, and enrollment in pre-K. The Education Advocate provides academic support. They can also help parents navigate things like creating an IEP, which is an individualized education plan for their child. Lastly, the Career Advocate helps connect teens and young adults to internships and/or employment opportunities and supports navigating the college application process. All Facing Forward case managers can bring in the family empowerment team to support their clients.
Well, thank you very much. And some wonderful programs that you described there. And as I mentioned before, I've been fortunate to see some of the impacts that are experienced from your clients, from clients that are just getting started in some of the programs, and then just having that sense of newly established security and stability, and that restored level of confidence to clients that are able to transition out of the program, and the pride that they feel in being able to be self-sufficient and hopeful and excited about the new opportunities that now exist for their children. And so great to hear about these programs and seeing this organization and how it's been growing and finding new ways to help people and have a really positive impact on so many lives. But of course, we know Facing Forward, also Food Depository, can't do it in isolation. So let's transition now to a conversation about collaboration. And Amy, you can begin on this. Talk a little bit more about some of the other organizations that you've been able to team up with and how that's helped.
Yeah, thanks. As I keep referencing throughout our time together, we do this because of a network of amazing partnerships and organizations that are aligned in mission. We have a network of over 800 different programs and partners that are working every day to ensure folks in our community have access to food and the other benefits and resources. So that shows up, as I mentioned before, as those pantries and soup kitchens, those meal programs for youth. It shows up in places where older adults gather to make sure that they have groceries as well. We have partners that are school systems. We have partners that are community organizations. I think a really great example of how partnership works for us is that recognizing that there's a need and trying to understand that need from those who know it the best, those that are in community, supporting that community, a part of that community, and then co-creating a solution. So there is a body of work right now that we have in partnership with Breakthrough Urban Ministries, as well as the Hatchery program, really connecting youth out of school who need access to food, and making sure that we're investing in community and connecting those prepared meals from the hatchery to the youth at Breakthrough. That's one of many dynamic examples of how we think about addressing the issues of hunger. I think what's also important to connect the dots on is even the screen today. Food Depository, yes, food. Facing Forward is housing. So how do we work together? How do we align our missions to make sure that we're sitting at tables and talking about collective solutions? that really have meaningful and long-lasting impacts on breaking that cycle of poverty. And so thinking about what are the issues and what are the barriers that communities face that we're trying to support, and how do we co-create meaningful and long-lasting solutions. So there's lots of opportunity. Again, it goes back to thinking about what's the need and who should be at the table in addressing that need, and who are the right partners to show up. So it's a really iterative process, but there's an amazing network on this call today. All the folks that have joined today, as well as across Cook County, who are really showing up and caring about these issues.
Amy, thank you. And Venus, facing forward, who or what organizations have you been able to collaborate with to help in your mission?
Facing Forward is part of a citywide effort to end homelessness. We're part of what is called the Chicago Continuum of Care, which brings together nonprofit service providers, government agencies, people with lived experience of homelessness, and others who are interested in solving the challenges of homelessness. We coordinate together for a comprehensive response in Chicago. Partnerships with landlords has also been key. We work with over 200 landlords across the city of Chicago to identify housing units for families and individuals in Facing Forward programs. Facing Forward works with over 100 community partners, providing a wide range of resources and services in areas like healthcare, household resources, legal resources, food access, education, and professional development. We would like to give a special thanks to a few of our community partners. The Chicago Furniture Bank, who has given families access to household items that can furnish their apartment. Cradles to Crayons, who provides children through the age of 12 with educational toys and books as well as clothing. Share Our Spare, who provides parents with infants and toddlers critical supplies such as diapers and hygiene kits. We also want to recognize and thank the many health providers, mental health providers, and substance use counseling providers throughout the city.
Thank you so much. And so from organizations to individuals, I know we have many people in our audience this morning who hopefully thinking about what can we all do to help. So Amy, what do you need? How can people who are listening or watching in the audience this morning play a role in assisting in what you do?
Yeah, there's so many important ways. Number one, I would say volunteer. Whether it's coming here to the food depository and helping us repack produce and get things out into community from the warehouse here, to volunteering at one of our in the community distributions, such as with the Fresh Truck, or looking on our website and using our Find Food locator to Google the nearest food pantries near you and volunteer directly in community. There's a lot of opportunity to connect in the actual distribution of food, and that's a really important and powerful way. Obviously, financial support is needed and desired always. Of course, investing in fresh produce and proteins, while a lot happens through donations, it's still really critical to make sure we have the right food at the right times. And so a dollar can go a long way, as well as the in-kind gifts that support the actual programming and distribution of food is super critical. I touched really lightly earlier about the issues that surround advocacy and really understanding policy and those issues and lifting our voices, and how we can show up to advocate for the programs and the legislation that can support our issues that we are talking about. So there's certainly a way on our website to connect, as well as to keep in touch with us and continue learning and signing up for one of our newsletters. I know after today's call, we'll be sending out some information on all those ways to connect. So there's lots of ways to engage, and it takes all of us as a community for these issues.
Thank you. And Venus, how can people in the audience help you and help Facing Forward in its mission?
Yes. We depend upon support from our community to fuel our mission to end homelessness. We appreciate your support in whatever way you can give it. Giving Tuesday is coming up on November 28th, and it is an exciting time to support Facing Forward. It's the biggest fundraising day of the year and kicks off our season of giving. We encourage our community members to make a donation that day, and all donations will be matched dollar for dollar. Our annual holiday gift drive is also happening now. You can sign up to sponsor a child's wish list and pick out gifts to bring them some joy. We also welcome groups to sign up together. We're always looking for in-kind donations throughout the year for things like housewarming baskets. And lastly, we encourage you to stay in touch and help spread the word about Facing Forward. So keep an eye out for the follow-up email we'll be sending after the panel for more on how to follow us on social media and sign up for our newsletter.
All right, so now we're going to begin with our Q&A portion. So if you have questions, go ahead and feel free to pop them into our chat, and we will look for them and bring them into the conversation. But for now, I want to talk about the impact of the migrant crisis in Chicago. And Amy, you can begin with just describing a little bit describing a little bit more of how that has impacted what you do, how the need has changed.
Yeah, I think that it is a top of mind and an important issue. And we go back to the foundation of our belief and our value that everyone has the right to access the food that they need in a dignified way. So for us, that has shown up in what we do every single day to ensure we're getting people the food that they need in the right places. And so working really closely with partners all throughout the city to ensure that we are getting both meals and information to new arrivals in our city. So working very collaboratively in some of the models that I've already shared, ensuring that people know how to access the benefits that they are eligible for, making sure new arrivals know how to access that emergency food system that we've talked about, but then actually working really strategically to make sure that in places that our new arrival, our new neighbors are staying, have access to the nutritious meals. So we are working with a network of partners, of vendors that are distributing meals at some of those locations, including police stations. So again, being really intentional about investing dollars in local meal providers and vendors, and activating those meals to go to shelters, as well as our own meals that we create to make sure that folks have that connection to food. This is not taking away from anything that we're already doing. It's what we do. And so being able to plug into the already existing infrastructure was really important to us, and ensuring in no way is it taking away from anyone, but that we're really working collectively to make sure everyone has that access.
Really interesting and good to know that there is a level of outreach that is taking place to some of those new arrivals at the police stations, at some of the new shelters. Shelters is still to come, but then pointing out that it doesn't detract from what is happening for the homeless community, other residents of Chicago. But of course, I would imagine with that pulling on the existing strain, how does that, and both of you can also address that, impact the need or the funding landscape and the need for donors and also government funding as well?
For us, we recognize, if we're talking about the issue of new arrivals, we do recognize it needs to be a partnership. It needs to be a public-private partnership that really attacks and not supports the issue that we're navigating today. That's truth throughout all of the work, right? None of this is going to happen. None of these solutions are going to come forward for any of these issues surrounding poverty unless we are working collectively from both a policy and governmental structure and funding, as well as private funding, and mobilizing communities who care and want to be a part of that response. And so that's how we treat all the issues. That's how we treat this one as well, because it truly is a collaboration and a partnership that carries forth solutions.
And either one of you can address this or both. Let's talk about the impact of inflation. I believe last year we were still talking about the result of the pandemic, and people still trying to rebound and come out of that period where a lot of jobs were eliminated, and people were trying to manage new family situations, working from home or either not working at all. And then now, adding to some of those challenges, you have the cost of goods, even gasoline. Everything is increasing. And you talked about, and then Venus, also pointing out that homelessness, not necessarily a mental health issue, not necessarily a substance abuse issue from the beginning, but many families living paycheck to paycheck. So if you're already in that situation where things are tight, and then now budgets are being having to be stretched even further. What are you seeing as of late with the impact inflation and how that is impacting families, and where you're seeing the need go as a result of that?
Sure. The cost of everything definitely has gone up, right? We've all kind of experienced that, including rent, which further exacerbates the issues that we both talked about earlier, putting a strain on our neighbors. And it's a real challenge, right? And I think that collectively, our organization has always been mindful about partnering with the clients that we serve to get creative about what they are working with within their means. Of course, with everything that is going on, like I said, it's made the problems that much larger. But finding ways to work within, going back, like using a strength-based perspective. So who's in your family system, who's in your system of care, your community? How can we tap into these resources, leaning on our partnerships, brainstorming with our neighbors like the Greater Chicago Food Depository, and getting creative about finding those solutions. But that is a constantly changing paradigm that we have to shift with. And so I think it's important for us to always be on top of that and assess that and see what can we do. But that is a real challenge that we are seeing and facing forward.
Yeah, I'll build on that. I mean, you heard me say earlier that one of the data points that we know is our data point, 13% higher utilization of our network this same time last year. And so inflation is truly impacting the choices that people have to make in terms of what bills they're going to pay, et cetera. And we definitely are seeing a lot more people, show up in the programs that we support, looking for that support, who haven't been before, which we are absolutely proud that we can be working in partnership with all of you to be able to provide that support. But it is indicative of the bigger issue, which definitely, again, ties back to inflation and all of the post-pandemic rollbacks of benefits and supports, and that exasperated issues that we've been talking about today.
Well, we appreciate everything that you do, and unfortunately, every time we have this conversation, the situation is tougher and more difficult to address. But I am glad that you both are in the fight, and you are with wonderful organizations that are really making a difference. And I hope that people listening, watching today are encouraged and also inspired to do what they can to be a part of the solutions and to get involved, volunteer, donate, whatever it is that you can do to try to help make someone's life a little bit better. Again, my name is Michelle Relerford. We're going to conclude our program, and I want to thank you, Venus London, and also Amy Laboy, for sharing all of your insights with us this morning. And on behalf of Facing Forward to End Homelessness and the Greater Chicago Food Depository, Thanks to all of our participants as well for joining us. Of course, again, the work does not end with this panel. It begins with each of us taking meaningful actions in our daily lives, volunteering, supporting local initiatives, advocating for systemic change. Of course, there are numerous opportunities for us to contribute. So please be on the lookout for a follow-up email that will contain a recording of today's discussion and also information that you can use so that you can get involved and so that you can give back. Again, I'm your host, Michelle Relerford. Thank you all. Have a wonderful Thursday, and hopefully we'll see you next year.